We all have challenges in life: sadness, broken relationships, anger, bullying, grief, and isolation. But there is hope. Together, we can learn how to bring back joy, re engage with life, restore relationships, and to be alone without being lonely. Welcome to Psychology Talks.
Today, we have Dr. Susan Stuntzer with us. She is a rehabilitation expert, and she is going to be talking with us about living well with disability and all the things that go along with that. So welcome. We're glad to have you.
Glad to be here.
Perfect. She has come a long way to be with us today, so join our conversation. So why don't we start with who you are? So you are an author, you are a faculty at university, and you have done research, and so you've done lots of stuff in your career.
Yes, I have. So maybe I'll just tell you a little bit about my background, kind of give context to some of the discussions that we'll be having. My background is in rehabilitation psychology. And what that means is I work with people with disabilities to do many things. People often think when they hear rehabilitation, it means helping people work through substance abuse or drug addiction, or they think employment. But actually, when I have the conversation, I share that it's much more than that.
Right.
It's about independent living. It's about coping, living well with the disability, which is some of what we'll cover. But my background, I started in this field in the mid-1990s. I have worked as a rehabilitation counselor, as a faculty member. Currently, I work as the Director of Accessibility Services at Southwestern Oregon Community College. As you said, I've written, done some research. So I guess I'm one of those professionals that I like to have my hands in many different pies.
Absolutely. And we love that. We love having people that have lots of different areas to pull from when they speak with us. So why don't we just kind of jump right on in and start talking about what it is to have a disability, maybe.
Okay. Well, I think that when it comes to living with the disability, again, it's a term that encompasses many things. It could be someone living with a physical condition. It may be sensory, such as vision or hearing. It could be cognitive, intellectual, could be neurological. Some disabilities are stable, meaning there's not a lot of change in their course. Others are more progressive.
Absolutely.
So it's a term that captures a lot of conditions. Something we're seeing more and more of these days are health-related situations, such as diabetes or IBS or things that are stress-related.
Right.
Mental health.
Right. And so one of the things that you and I have talked about just in our own personal conversations is about how a disability can be acquired. So through an injury or an illness, or it can be something that maybe someone was born with, so they've had it all of their lives, and how that can look different.
Right.
So we've talked a little bit about what disabilities are, but let's maybe talk a little bit more about a topic that I think gets overlooked sometimes, which is the difference between a visible and an invisible disability, and how you see that come out in the people you work with.
Okay. Yeah, that is a really important topic, Angela, because I think as you and I have discussed this some, there are some issues that are similar that cross domains between visible and invisible disabilities. But I think when we talk about disability, oftentimes people will recognize something as a disability when it's visible. Okay, because it's concrete. It's something that they can see.
Right.
What's different about invisible disabilities is people, I'm going to call them the onlooker.
Right. Yeah.
And that would be someone who is not as familiar with people with disabilities. And so when they don't see that someone has a disability, it may be hard for them to capture or grasp that it's there.
Right.
And so sometimes the emotional part and the frustration, some of the coping issues that come up with are people may feel like they're not um, believed by others, or why is this so hard to get people to understand that I have a disability because they can't see it.
Right. And I've had people even come up and say things to me about, you know, people see me park in a disabled parking spot and they can't see the disability. And so they feel entitled to say something to me
Right,
because they can't see it.
right.
So that's a very real practical way that it might come out or be displayed with for people and maybe end up in some sort of altercation.
Right. So let's say, going off that example, if
Mhm.
somebody has a heart condition,
Mhm.
okay,
Mhm.
it may affect their breathing,
Mhm.
how well they can walk.
Right.
And so then, but to someone else, they may not see that.
Right.
Versus, let's say, if somebody has an oxygen tank with them or they're um, walking with a walker, that's something that other people can recognize.
Right.
And
Yeah.
so their mind will say, "Oh, it's okay that they park there."
Right. And the other thing I can think of with an invisible disability is, say, a TBI, a
Mhm.
traumatic brain injury. So, something where someone has a much more difficult time thinking or processing information um, that may display itself in an unusual way when they're conversing with someone else or where they're put into a situation where they have to make a decision or
Right.
a judgment about how to act or how to speak or whatever the situation may be.
Right.
And I'm sure you have a lot more examples about that than I do.
Yeah, and we often see that with people who have, like I said, cognitive issues or learning disabilities, like you said, TBI. And so I think, regardless of whether it is a visible or invisible condition, it's important that people um, know about their situation and how it is that it impacts them.
Mhm.
Okay. Because sometimes people may need to educate others or explain
Mhm.
um, what their experience is or what their needs are, or if somebody's trying to access services.
Right.
Okay. And
Mhm.
so a part of working with people with disabilities is getting an idea of not only what's taking place, but what does that look like within you?
Right.
And what type of experiences or barriers do you have
Mhm.
so that we can talk about how we can best address those?
So teaching them how to be a good self-advocate.
Hmm.
Okay.
Definitely self advocacy is definitely a part of it.
Absolutely. Yeah. Okay. So how would you talk with someone about how to go about doing that? How to advocate for themselves in whatever environment they're in?
Okay. Well, currently in my present position, I do work with students,
Mhm.
and I try to get a handle on how much they know about their disability
Mhm.
and how comfortable they are advocating or self advocating.
Right.
Because oftentimes, when students or people are becoming young adults,
Mhm.
okay, 18, 19, 20,
Mhm.
sometimes people haven't had a lot of experience in self advocating.
Right. Because maybe
And
their parent had done it before.
right. And
Right.
and so a lot of discomfort can come up,
Mhm.
okay? Um, and it can feel very awkward. So I talk to people about um, now, as people become young adults, that this is a good chance to practice. And while you
Mhm.
ask me how do we go about doing that,
Mhm.
a lot of it is about practice and
Right.
being willing to work with our feelings and maybe be a little bit uncomfortable.
Yeah. And that idea of being uncomfortable is something that, um, you know, regardless of whether or not you have a disability or what your situation is, if you're wanting to make a change, that willingness to be a little
Right.
bit uncomfortable is something that we all have to do.
Right. And so, part of self advocacy, I think, too, is learning to not take things personal.
Right. Yeah.
Say you use the example of parking.
Mhm.
If somebody does come up to you and
Mhm.
question you
Mhm.
about why you're parking someplace,
Right.
to try to use your rational mind,
Mhm.
and to not take things personal. And because when we can be more balanced in our approach, then we're able to articulate and communicate in ways better than when we're caught up in the emotion or being on the receiving end of
Right.
somebody else's comments.
Right. So trying to set the tone and the pace of the conversation instead of allowing the other person to establish that and keep it going.
Right.
So if they're approaching you in an angry manner, not getting angry, but staying calm, staying focused, addressing it in a manner that isn't going to then incite more conflict.
Right. And sometimes that means taking a step back,
Mm-hmm.
To kind of check what's going on within yourself, that you're not buying into or being pulled into another person's
Mm-hmm.
reactions.
Yeah. What that makes me think of. There's this proverb that says, a kind word diffuses a situation, but an angry word creates wrath.
Right. Right.
So that's what that makes me think of is that concept.
Yeah, and as you say that, there is a term within our field that I want to say it's about containment.
Mm-hmm.
Being able to manage your disability and situations that come up, and kind of contain it so that situations don't ignite and progress.
Okay.
But that you're able to handle it in a more effective way.
Yeah. So, what are some of the other challenges that someone might face that has a disability?
Well, I think the number one thing that I've continued to come across as a professional, as a person with a visible disability, um, and within the research is societal attitudes.
Mm-hmm.
Um, it is 2019,
Right.
and I would hope that we are farther than we are.
Yeah.
Okay. But I think the number one issue that people pretty consistently grapple with is that of societal attitudes.
Okay. Can you give us an example
Give
of
an
that?
example. So, it might be about expectations of what people are able to do, not able to do. There's still some inaccurate beliefs about
Okay.
the abilities of people with disabilities.
What are some of those inaccurate beliefs?
So, like, what a person is able to do physically,
Okay.
and not based on what another person sees.
Mm-hmm.
Okay. We see it a lot in the realm of employment.
Mm-hmm.
Um, there has been information out there in the past about beliefs and myths tied to the employment of people with disabilities, which may be such that if I hire someone with a disability, they'll cost me more money,
Okay.
which is not true.
Okay.
Or that if, as an employer, if I provide somebody with an accommodation, it's going to be a lot of money, when
Okay.
what we know is in reality, 80% or more of accommodations are less than $500.
Oh, okay.
Okay.
Yeah.
Um, there's the belief that sometimes people will not be reliable or show up to work, which what we know is the opposite is true, that um, only about 15% of people with disabilities from the US Bureau of Statistics, 15-16% are employed,
Okay.
compared to 65% of the general population.
Wow.
So there's a huge disparity between the employment of people with disabilities and people without disabilities.
Yeah.
And so a lot of people really do want to go to work. But again, there's some misunderstandings around that still.
Yeah. So, how do people with a disability overcome that? How do you talk with them about that?
How do we talk with them? Well, again, it kind of depends on where people are at. Um, what we find is that some people want to go to work,
Mm-hmm.
um, and then there's others who maybe don't.
Mm-hmm.
I think where it gets a bit sticky is when people are on SSI or SSDI,
Mm-hmm.
because again, that's not a perfect system.
Right.
But people oftentimes want to go to work, but then there's maybe a cap on how much they can make, and then there's always that concern about insurance.
Okay.
Okay.
So if they go to work and they make too much money, then they'll lose their insurance benefits. but
Well,
maybe they're not going to make enough at the job to replace that, or is
and
that?
it's a situation that has to be, I guess, worked through very carefully to see how much a person
Okay.
can work.
Mhm.
Um, and I know the law has expanded that people don't lose their benefits right away, but again, there is always concern with that. So, um, when we work with people with disabilities, it's important to look at them and their situation because every single situation is different.
Of course it is.
And well, I know you said, of course
Yeah.
it is, but what I explain to people is that you could be working with two people with the exact same disability
Right.
and how they cope, how they look at themselves,
Mhm.
how they view what they're able to do, just their whole worldview, everything may be very different.
Right. Yeah. And
So,
I sort of consider that in the concept of culture,
right,
that, just because you have two people that are the same race, or you have two people that are the same gender, everyone comes from a different culture. And whether that's, um, you know, here we're in Oregon, so and you're in Southern Oregon, and you're not
right,
only in Southern Oregon, but you're in Southern Oregon on the coast.
right,
So every little piece of our environment is going to impact how we
hmm,
see the world and our worldview.
right,
And not only every piece of our environment, but also of ourselves. And like you said, how we view ourselves, how we view the world, how we think of our ability, and whether or not we can.
right. And I think a part of that is how do people view the experience of living with a disability?
Yeah.
Okay, and so some people, I think you had asked me how do people in the beginning, how do people um, approach that
Yeah.
living with a disability?
Yeah.
And so, you know, some people, I think early on, when there's been a major life change, they
Mhm.
may see themselves more as the disability, and
Right.
so the presence of a disability kind of um, oversees who they are.
Right.
And then as we work with people, our goal is to get them to a place where living with the disability is a part of who they are.
Right. So I can think about this in terms of uh, having any life change,
Hmm.
getting married, having a child, how it changes your identity in
Right,
some respect.
right,
I remember when I had my first child, and I had to think of myself as, now I'm a mother. That was a big shift for me. I was a little bit older. I was 32 when I had my first son. So for me, that was a big shift in my identity.
right,
And so um, that took a while for me to get there, to incorporate that as just a piece of who I am. Um, and so it sounds like that same process is something that someone with a disability is going to have to go through. And maybe it's something that um, what I'm hearing you say is a little bit of a correction for them. So
hmm,
maybe they had grown up in an environment where they were always referred to by their disability. And so it's a little bit of work on, or maybe a lot of work on figuring out um, who they are besides the disability.
right. And the other thing, so there's a third direction that this
Hmm.
goes sometimes. So in more recent times, we hear more about disability pride.
Yeah.
So then there's another view from some people who say, hey, I have a disability. I'm glad that I have a disability. I wouldn't change anything. So I don't want to separate myself from the fact that I have a disability.
Absolutely.
What needs to be changed is how people view me or um, see it as something that I need to change.
Absolutely.
Okay, so when I do talk about helping people integrate the disability into their life, please know I'm not saying that people shouldn't feel good or positive about it
Hmm.
because there is definitely a positive side of living with the disability, but people have to get past the negative side
Okay.
to see what some of those benefits are.
And what are some of those benefits?
Okay, well, funny you should ask that. So and I'm going to use disability as the catalyst, but I mean, this
Hmm.
could be about any major life change.
Hmm.
It is an experience that, while many people may not understand it initially,
Hmm.
when people stick with the process of learning to adjust to it,
Hmm.
they may find like a higher purpose in
Okay.
life. They may find meaning. They may report that they don't want to, that if they were given a choice, they wouldn't change having a disability because it's made them a better person.
Okay. Right.
It's taught them about tenacity and perseverance. Yeah. Maybe it's helped them develop a stronger sense of spirituality or relationship with God or a higher power. But the whole idea is that people report that their life has changed for the better, and that they don't feel that that may have happened without the disability.
And that's something that I see in my work oftentimes when I'm working with families with children that have disabilities. One thing I see frequently is that they will have developed this whole network of people that are supports for them outside of their family or outside of their work that are going through similar issues or have a child with a similar diagnosis. And so they're able to really expand on who is involved in their life and what their resources look like and who those people are that speak into and feed them.
Right. So a part of what you had just mentioned is, having a network is really important. Support, knowing who you can count on. So you had asked me a little bit earlier, what are some ways that I work with people? So as you shared that, what came to mind is, I try to help people understand that you get to decide who's going to be in your hula hoop.
Yeah, I like that.
Yeah, I do too. And it's not my original idea. It's actually a dear friend of mine that taught me that many years ago, who used to say, Susan, you get to decide who's in your hula hoop. And I've always appreciated that, because when you live with a disability, there's a lot of negative messages out there and input. And sometimes people aren't always aware of the impact that has on them.
Right. And I've seen more positive imagery in media with regard to people with disabilities. And I'm seeing a lot more inclusion in not just the Goodwill commercials, but with different products that are being used. And so in not just showing the regular average American and expanding on what our idea of an average American is.
Right.
And so I think that that's lovely. I saw a commercial recently and it almost made me want to cry. It was so beautiful because it had so many different people from so many different walks of life that had different things that they were dealing with. And you can see them. Like you can see the things that they're dealing with.
Right.
And I was like, that's real.
Right.
That's real.
And, one thing that I have noticed as a professional, but I have paid attention, is one of the websites I'm a part of is LinkedIn, for professionals. And there's a gal on there named Deborah Davis, I believe. And she has a business called Push Living.
Okay.
And so part of what she does is help orchestrate travel for people in wheelchairs or needing accommodations. And I just think that that is a brilliant idea.
Absolutely.
So, I mean, that's just one example of many out there that I've noticed that I'm like, wow, so there's a lot more positive examples than what there used to be.
Okay. So let's say that someone comes into your office and you're going to work with them as a counselor on living well with a disability. Whether it's an old disability, a new disability, invisible or visible, what's your first approach that you're going to take with them in learning about them and the disability and how it's impacted their lives?
Yeah. Well, my approach to working with people is using a holistic perspective. Yes, learning about the disability is a part of it, but I want to know what their experience is like. How do they view it? Okay. What is their understanding? What do they know about how the condition affects them, how it's changed? How does family fit into that? Because it is possible that the person views their situation in one way, but the family something else. And so I want to get a really good understanding initially of how well they're coping and what they know about it and who they are within that context, because that kind of gives me an idea of, Does the disability or condition frame how they see themselves and their abilities? Or have they moved to another place where they're more accepting of it and now they're into strategies or actions they can take?
Okay. So what would be your top 3 things that you would do with someone or teach them about
Teach
living
them.
well with disability?
Well, I know we have talked about this some in the past. As I have shared, being able to identify what you can control, psychologically speaking, we often refer to that as locus of control. But when we live with a disability, it's important to separate what you can control from what you cannot. And if you don't like the results that you're getting, please be willing to try something else.
Yeah.
Okay, because that's a part of the adjustment, how people learn who they are and what they can do.
That reminds me of the Serenity Prayer. So anyone that's
Right.
familiar with AA and the 12 steps would know the Serenity Prayer.
So yes, the serenity prayer is, God grant me the serenity to accept the things I cannot change and the courage to change the things I can and the wisdom to know the difference.
Yes, absolutely. So much in that.
And that phrase or some version of that is very applicable to living well with a disability.
Yeah.
Whether it's about the condition itself, whether it's about interacting with other people, whether it's about coping with our emotions, trying to affect societal change. I mean, it could be applied to anything.
Yeah. So that was the number 1.
Yes,
So,
number one.
so what's the number 2 thing that you would focus on?
Another thing I like to do when I work with people is to pay attention to how they talk to themselves, because I think a part of living well with a disability that is not recognized always is, am I internalizing messages,
Absolutely.
or do I have coping skills that help me negate that or not internalize? Because again, another thing we know is that because of many of the situations that happen, and sometimes negativity isn't always verbalized. It might be a look, a glance, it could be staring at somebody, it could be a tone of voice.
Right.
Okay. But the person with the disability still feels it.
Right.
And so I would want to get an idea of, does a person internalize those messages, or are they able to separate themselves from them?
Right. So that's that self-talk
Mm-hmm.
that whether or not they're saying it out loud, what are
Right.
they saying to themselves internally? And maybe they do say it out loud. Maybe they find themselves saying little things, degrading themselves when they're talking to other people. And what that makes me think of is God says that life and death are in the power of the tongue.
Yeah.
And research has really borne that out over time.
Right.
And so, what's that third thing?
So the third thing I would kind of emphasize with people is that about being kind, or self-compassionate. Because learning to live with a disability is a process. It's not an overnight. And there's a lot of change, and there's a lot of things to figure out. And so being kind and nurturing and supportive of yourself and patient, and to stick with the process. And if something isn't working, try something else.
So, the idea of forgiveness,
Yeah.
allowing
Definitely.
yourself to make mistakes.
Definitely.
Yeah.
Forgiveness is very much related to learning to live well with a disability.
Thank you so much for being here with us today. I think this was a really insightful program and an insightful conversation that people can join us in.
Thank you.
Thank
Glad
you.
to be here.